Hi, this is Vaibhav Vaidya with the Fits on the Go blog here at AHA 16 in New Orleans. We're joined today by Dr. Tseng, who is a cardiac electrophysiologist at UCSF. Thank you so much for joining us.
My pleasure.
So, Dr. Tseng, you're going to be presenting a late-breaking clinical trial tomorrow called the POST-SCD study. Could you tell us more about the background of the study and what it's all about?
Sure. So one of the limitations in studying sudden cardiac death is that 90% of these episodes happen out of the hospital, and that's why 90% of them don't get investigated. And so for that huge majority of cases, we're usually making a guess as to the underlying cause. So I partnered with the medical examiner in San Francisco to do a full investigation, including autopsy, toxicology, and histology on every incident of sudden cardiac death in San Francisco over the last 4 years.
Wonderful, great. And what did you find in the study?
One of the most surprising things we found, or perhaps not surprising, is only a little bit over half are truly arrhythmic causes. 40% were non-cardiac, and another 4 to 5% were what we call cardiac but not arrhythmic. And examples of those were MI with valve rupture, tamponade, pericarditis, or acute heart failure. So only a little over half were actually arrhythmic causes.
Wonderful. Well, I guess you guys have a big trove of data now that we can look at for arrhythmic death. Yeah. Did you have any molecular studies on any of these patients, any channelopathies that were detected?
Good questions. So one of the biggest issues that we tackled was to first define what the underlying causes are and the epidemiology. In the second phase of the study, we have collected blood samples and tissue samples from all of these cases to link to the in-depth phenotyping of all these cases to plan for the molecular studies next. But among the other findings we had was the risk of sudden death is very different. Arrhythmic death is very different among females and in non-white minorities. So for example, in women, only 44% of causes were arrhythmic. In men, 60%. So we know a little bit more about men than women, and more than half of cases were not arrhythmic. Also, coronary disease is only about a third of the underlying causes. So our interventional cardiology colleagues have done a very good job in treating cardiovascular coronary disease. And we have a lot to understand as to what kills us suddenly in the modern era.
Understood. Great. There's just so many questions I want to ask you about this study. So what implications does this have for the relatives of patients, who were diagnosed with arrhythmic sudden cardiac death? Did you guys reach out to them, or what should we do with them?
Absolutely. So we did reach out to all family members. In fact, that's how we were able to have consent to transfer the specimens to our lab. But as expected, a lot of interest in terms of the underlying causes, and not just arrhythmic. For example, last month we coined the term sudden neurologic death for our cases that were out-of-hospital seizure deaths or strokes or bleeds. Those are a significant proportion of our non-cardiac causes. Overdoses that were occult were a surprising percentage as well, and you only need to open the paper to look at the opiate epidemic to understand that that's a big cause. So I think as cardiologists we can certainly focus on the cardiac and arrhythmic causes, but to make a dent in the overall burden of sudden death, I think we need to put some attention on these non-cardiac causes.
Got it, great. And then in the arrhythmic deaths, how many of these patients had structurally normal hearts versus structurally abnormal hearts who should have had maybe an ICD for primary prevention?
Good question. So in terms of primary electrical causes, that was a small percentage, on the order of 1 to 2%. Truly normal hearts, a small minority. A significant proportion had chronic coronary disease with depressed ejection fraction that would have been a candidate. Some others had dilated cardiomyopathy that also would have been a candidate. Now, what's interesting about our study, I'll say this, it's not a cohort study where people choose to be in a cohort and are motivated to follow up and get their meds and get the echo. This is a population study of sudden death in the community. So if somebody happened to get an echo, we got that information. If they happened to get an EKG, we got the information. But a surprising number of our sudden deaths may have been due to people just not presenting to care, not being adherent to their medicines, not following the recommendations of our cardiologists. And so I think we're doing a pretty good job, but more needs to be done to educate the community in terms of the importance of following up and seeking care.
Wonderful. Thank you so much for speaking with us, and congratulations on an amazing trial. I'm really looking forward to seeing the results in print and much more from your group.
My pleasure. My pleasure. Good talking to you.
For more videos like this, please go to youtube.com/fitsonthego.